workers going to work was because the federal government had no PPE, no masks, no equipment, no warning, no preparation. We had a president who lied to us from day one.
As ranking member of the Select Subcommittee, I am committed to following the facts for an objective analysis of how COVID-19 impacted our communities across the country, all with the goal of putting us on stronger footing to prevent and prepare for future pandemics. As I said, accurate and complete data is vital to ensuring that we as a country are as prepared as possible to handle the next pandemic better than the last. And with that, I yield back.
I now recognize the chairman of the full committee, Mr. Comer from Kentucky, for 5 minutes of questions.
Thank you. Governor Cuomo, do you stand by the March 25th, 2020 directive?
The March 25th directive was based on the CDC, CMS guidance.
So you stand by it?
They both do the same thing. Both
you
CMS,
said
CDC, and DOH.
Excuse me. You said that the directive followed CDC and CMS guidance. Are you aware of anyone in your office that asked CDC or CMS about the policies in the directive?
The Attorney General opined legally they were the same and said the March 25th order was consistent with the federal guidance.
Okay,
and
so
that's
you
how
stand by
enforced.
it, and you say it followed federal guidance. Then why did it need to be superseded by executive order? Was this because
it was
you were getting
superseded
bad
later
press?
on? I'm sorry, I didn't mean to interrupt you.
Okay.
It was superseded later on because we then got to a position in May, I believe, where we had enough testing capacity and we mandated testing for nursing home staff.
So it had nothing to do with public relations or bad
And
pressure?
it also, this was all politics all the time.
Okay.
And it bothered and scared people because they didn't know who to believe.
Okay. So on June 7th, 2020, your executive assistant sent this email writing, and I quote, "This is going to be the great debacle in the history books. The longer it lasts, the harder to correct. We have a better argument than we made. Get a report on the facts because this legacy will overwhelm any positive accomplishment. Also, how many COVID people will return to the nursing homes in that period? How many nursing homes? Don't you see how bad this is? Or do we admit error and give up?" Ms. Benton is your executive assistant. I believe she's sitting behind you. Did she write this email on your behalf?
Yes.
Governor, did you have an email account while you were governor?
No. Well, I may have had one, but I didn't use it.
Okay. Was there a reason?
I haven't used it in years.
Did you communicate in other ways with your staff? Text messages or BlackBerry
Yes.
messages? You did. You just said that you stood by the directive, but this email asked if it was time to admit error and give up. Was the March 25th directive an error?
No, this was the last line, sir, was tongue-in-cheek.
Okay.
This was an ongoing, raging political debate where the Republicans were saying March 25th caused deaths.
So
I said, answer it fully.
I understand, Governor. You testified that you were not aware of the directive until April 20th, 2020, almost a month after it had been issued. When you were asked about it at a press conference after you learned of the order, did you have any concerns about the directive?
When I was asked about it at the press conference, I was not aware of it. If I had been aware of it, my answer would have been very simple. I would have said, ask Donald Trump.
Did you ask questions after you learned about the directive?
After I learned about it, yes, I asked questions.
Give me some examples.
I was debriefed by the Commissioner of Health, who said, this is the theory of CMS and CDC and DOH, that these people are no longer infectious.
Did you ever discuss terminating or amending the directive after you learned of it?
When it was described to me that CDC, CMS, and DOH all thought this was a good idea, and they had a medical theory behind it, that these were non-infectious people, et cetera.
For time's sake, Governor, to return to the email, why did you direct your staff to get a report on the facts?